Hello and welcome to a topic of anatomical terms, and we're going to start looking at body positions and planes of movement. So, when we look at anatomical terminology, everything always starts in anatomical position. So, what I want you to do is actually stand up right now and get yourself into anatomical position and show me what that looks like. It should look something like this, where you are standing straight, arms are down at your sides, palms are facing forward. Everything that we reference is going to be in reference to this position. So everything starts from anatomical position, period. So when we start using the terminology of medial, lateral, superior, inferior, we always are going to start at this particular position so that everything is always correct. So let's do a little bit of quiz and see if what you already know. So let's go ahead and answer this question. How about this one? Your fifth digit or your pinky is what to your thumb? Your knee is what to your ankle? Your hand is what to your shoulder? All right, if you have torn both your right and your left anterior cruciate ligaments, it is what kind of an injury? Your left hand is what to your right knee? All right, let's start with some of our motions now. So, looking at our general movements, what I want you to do is show me flexion and extension of your shoulder. Now, I want you to do it for your elbow, for your wrist, and then your fingers, your neck. Should be nodding yes or no to be able to do that. Excuse me, you'd be nodding yes back and forth to do that. Your hip and your knee. And there's something a little bit different as we go from the knee. Instead of flexion going towards the front of the body, we should be going towards the back of the body. So let's take a look at just some examples of this to make sure we were all on the same page. All right, so we've got flexion of the shoulder just coming out straight in front of you, and then extension is when you drop it back down again. So flexion is up and then down. Here's our elbow. Flexion is up, bringing the hand to the shoulder. Extension is down again. Now our wrist, we've got flexion towards us and then back around. Now we've got our fingers. Flexion is up, extension is down. Hip can be done two different ways. So you can basically have it coming up like this, or this is also hip flexion as well. Extension is when you're coming back up to the right anatomical position. And then here's our knee, in which we're flexing now behind us, and extension is when it's coming out in front of us again. All right, next we're going to move on to our abduction and adduction. And I like to phrase it that way just to make it a little bit more clear when I'm saying it, because abduction and adduction sound awfully similar. So abduction versus adduction. Abduction. Abduction is when you are having something go away from the body. It's like it's being abducted, right? So it's something that's being stolen away from the body. So the movement is moving away from that midline. A deduction, think of it as when things are coming back to the midline or they're being added to the body. So let's do a little demonstration. I want you guys to work on your shoulder, abduction and adduction. Can you do your elbow? Hopefully not, right? Our elbow only really works in one direction, which is the flexion and extension. It does not do abduction or adduction. The wrist, can you abduct the wrist and adduct the wrist? I like to think of this as kind of like if you're doing it and you're in anatomical position, you almost look like you're a penguin that is kind of like flopping a wing a little bit on the side. Your hip, make sure you're practicing your hip abduction and adduction. And your knee is another one that should not be able to abduct and adduct unless you have got some issues with some of your ligaments. The neck and the trunk can also abduct and adduct, but we usually call these like side bending or lateral flexion. But that's kind of what that motion is like when you're bending to the side, either with your neck or your trunk. All right, so here we've got abduction and then adduction. So abduction is when it's going out. Adduction is when it's coming back into the body with the shoulder. We can do the hip. Abduction is out. Adduction is in again. And those are those examples that we have there. Next, we have medial and lateral rotation, also known as internal and external rotation. So medial and internal rotation are the same thing. Lateral and external rotation is the same thing. Now, rotations is when you have movement along a longitudinal axis. So you're going to see a rotation is happening so that it's along the length of the extremity. So you can abduct and adduct the hip. You can actually do the knee, but the knee has to be flexed in order to do that. You are not able to rotate when it's in the extended normal anatomical position, but when it's flexed, and like say you're sitting down on the ground, or excuse me, on a chair, you are able to do very slight rotation of the knee, very slight. And then shoulder, you can also rotate as well, and also the neck. So here's our shoulder. Of internal is when it's like, here, let me think. Internal is when you, I'm going to show this right here. That's internal, that's external, internal, external. To demonstrate it, and you can see it a little bit better, there's internal, external, internal, external. So it's the same motion, it's just showing you with a bent elbow. And here, when you're looking at the foot, it's moving back and forth, but that motion is actually happening from the hip itself. So when we have this rotation, you're seeing it in the foot. I'm going to keep backing up to show you. When you see it on the foot, it's actually coming from the hip. So you can see right in here where the actual hip is the one that's rotating. And then we can also have rotation of our cervical spine, which a lot of people just reference as your neck. Okay, so we also, beyond rotation, we also have circumduction of the shoulder. So everybody show me circumduction of the shoulder. And it should look something like this. And it's a combination of several movements. You actually have flexion and extension in there. You also have abduction and adduction. And then you also have some rotation. And you can see it happens in the shoulder, and you can do it in the hip as well. So those are our two joints that we can have circumduction with. In order to have true circumduction, it has to be a ball and socket joint. So even though other body parts look like they might circumduct, in order to actually have circumduction, you have to have that little added rotation in, and you actually need to have a ball and socket joint to be able to do that. Now we've got some specialized movements of the feet. So we've got plantar flexion and dorsiflexion. So let's do plantar flexion and dorsiflexion. You should be having, for plantar flexion, your toes become pointed. For dorsiflexion, your toes lift up. And those are the two different things. Now, you might ask yourself, how can I remember these different names that we have? So plantar flexion, a lot of people talk about planting your foot onto the ground, or if you think of plantar warts, those are usually on the bottom of your foot. So that's like the bottom part and the toes being pointed, versus dorsiflexion is when you have your toes coming up. We also have eversion and inversion. Eversion and inversion. Can you show us what those movements look like? Let's take a look on our video. So first we're going to start with plantar flexion and dorsiflexion. Plantar flexion, dorsiflexion. Now we'll get a different view and we'll have inversion, eversion, inversion, eversion. I think of it as like having the sole of your foot, that plantar surface of your foot, either pointing in, which is what inversion is, or out, which is what eversion is. So I'm just going to replay that for a quick sec. So inversion, eversion, inversion, eversion. All right, we've got a little more special movements. This one's of the forearm, and this is actually not the elbow. A lot of people think this is occurring at the elbow, but it's actually at the radial ulnar joint. We'll talk about that in anatomy, I'm sure. But show me pronation and supination. So supination is often when you're in anatomical position, your hand is already supinated. You can think of it like you could hold soup in your hand, right? Pronation is now when you are going to dump that soup out by rotating that radial ulnar joint, right? And I'm going to actually show you what's happening in that movement in just a moment, but it's essentially the distal end of the radius, which is one of the bones we have in our arm, rolls over the distal end of the ulna, which is the other bone we have. But the radius, the proximal side of it, the part that's closest to the elbow, actually just spins in place. It doesn't flip over anything. It just spins in place. So here's our demonstrations: pronation, supination, pronation, supination. So just kind of showing you that difference that we have. And then to show you what's actually happening here in pronation, we get a crossing of the bones right here at this level. So you can see this cross across here, but the head of the radius is staying right here, still attached in the same position. So here's when they're side by side. This is our radius right here. This is our ulna right here. When we go from supination into pronation, that radius crosses over on this distal end while the proximal end stays in place until the bones are actually rolled over each other. So that's our pronation and supination. So we've got a few special movements of the scapula as well. So I want you to do protraction and retraction. Protraction, shoulders are going forward. Retraction is when they're going back. Then we have elevation and depression. So elevation is like you're shrugging your shoulders. Depression is when you're lowering them. Rotation of the scapula. And there's upward and downward. And you're going to have to move that whole shoulder. It's almost as if you are doing shoulder abduction to get upward rotation of the scapula. Those movements go together. And then downward would when you are doing shoulder adduction is you'll get scapular downward rotation. So just looking at a couple, this is our protraction, retraction, protraction, retraction, right? And then we have elevation, depression, elevation, depression. And then we'll show you, I'm going to turn around the back way, and then you've got upward rotation, downward rotation. It's hard to see because my shirt is there. So I thought what I would do is actually show you anatomically what's happening. And you can see all right, so here's our elevation and depression. So you can see those movements of the scapula itself. And here's our rotation. See how when we're abducting and adducting, that scapula rotates as well. Now here's our protraction and retraction. And you saw earlier, it was looking at adduction and abduction of the scapular movement, which is very similar with what you see with protraction and retraction. All right, so now let's talk planes of movement. Now, please hang in with me here because I know that this is often a confusing topic, but you are able to go back and play this video over and over again to be able to help solidify it, and we'll try to walk it through easily. So we've got planes of our body. So we have different ways we can section off our body. And these are the different planes that we have. So which plane divides the body into the top and bottom? So that should be our transverse plane, also known as horizontal or axial. I know, everything has multiple names when we get into anatomy. So this is our transverse. It divides it from top to bottom. So which plane divides our body from right to left? So this should be our sagittal, or also known as our median or mid-sagittal. Most often it's called sagittal though, as well as the transverse is most often called transverse plane. Then lastly, what separates the body from front to back? This is our frontal or coronal plane. And I'll be honest, those two are used interchangeably all the time. So you just need to understand that some people say frontal, some people say coronal. I actually go back and forth between the two with no rhyme or reason of what it is that I'm doing. So we'll just be using those throughout the time period of both frontal and coronal. So here's just kind of a picture of it. So our transverse plane was the one that is this sheet of glass right here that separates the top of the body from the lower part of the body. Here was our sagittal plane. This sheet of glass is separating the right from the left side of the body. And then our coronal plane is separating the front of the body versus the back of the body. So those are just talking about the planes as they are separating the body. But now we can put movement to them and talk about what plane of movement is the movement in compared to the body. And I want you to just sit back and listen for a moment because there are two different ways to visualize planes of movement. And usually somebody will really latch on to one versus the other. So if this first one is not making sense to you, hang in there with me because the next way that I describe it might work better for you. So one way in which to do this is to identify the axis of rotation. And then the axis is exactly perpendicular to the plane. Now, how can you visualize the axis of rotation? So if you remember back in kindergarten, if any of you guys did this, Halloween, one of my favorite holidays, we would make skeletons out of like cut out paper plates or pieces of paper, such as the one that you can see right here. And they were attached together by these little brass fasteners. I think some people call them rivets as well. And the way that you would attach the two pieces of paper is that you would just punch it through both pieces of paper and then you would fold the little, legs out on either side. And then that is like an axis of rotation. So here between our humerus and our radius and ulna, we've got this here, and this could move back and forth in comparison to this one. Same with the shoulder. The shoulder was here and it could move back and forth. So what I want you to imagine when you're doing these movements is that if you had this little brass fastener here and you were going to stick it in your body and still be able to do this movement and it works around that brass fastener, what the plane of movement is in is exactly perpendicular to that plane. So let's kind of go over a couple of examples. So here we've got flexion and extension. Flexion and extension. Now, go ahead and do this on your own body and try it out. Do flexion and extension of your shoulder. Now, if you were going to put in one of these brass fasteners into your body and it would still allow you to be able to do this movement, where would it be going into your body? Where would this access be? So, hopefully you came up with something like this. So you've got a pin coming in from the side of your shoulder, pinning it to your trunk. So what you can imagine now, if we put this with the video, is you can kind of see if that pin was there, I would still be able to go up with my arm and down with my arm in this flexion and extension. And that access point coming straight in from the side of my arm would still allow me to do that flexion and extension. Now, what you need to remember is that the axis is perpendicular to the plane. So this plane is now going to be straight perpendicular to the axis. So this plane is the plane that is separating my body from right to left. Or this is actually my right, from my right to my left, right? So we are looking at which plane separates from our right to our left. Well, we have our sagittal plane. So that's our sagittal plane. Let's do another example. All right, so here we're going to have our hip abduction. So it's coming out and going back in again. Abduction, adduction. Now, if you had to stick a pin in somewhere that would still allow you to be able to do that motion while you're doing that abduction and adduction, where would that pin go? Take a guess. All right, so hopefully you came up with it would be coming in straight from the front of your hip. So it'd be coming like almost right into the groin area, right? And if we add our video to that, can you imagine that that would still allow for that motion to be able to go out and back in again with it coming straight in from the front of me? Now remember, that axis is perpendicular to the plane of movement. So when I put my plane of movement in compared to that axis, it is now the plane that separates my back from my front, right? Because it'd be cutting me down all the way from top to bottom, from the back to the front. So in fact, this would be our frontal plane, also known as coronal. So next, let's deal with our rotation, and we're going to do our shoulder rotation. So here we've got internal rotation, external, internal, external. Okay, so now if you had to put a pin in and still be able to do this motion, where would you put this pin in and still allow it to internally rotate and externally rotate, or medial rotation and lateral rotation? Hopefully, this is a trickier one, I would say, but hopefully you're realizing it would actually be coming straight from the top of the shoulder. So if I had that pin straight from the top of the shoulder, now when I rotate in and out, it's actually allowing for that motion to still happen. So remember, our axis is exactly perpendicular to that plane, or to that, our plane, excuse me, is exactly perpendicular to that axis. So if I had to go perpendicular, it's going to be cutting crossways across my body. So this is the plane that is separating my top of my body from my bottom of my body. So this plane of movement is our transverse. Okay, so you can go back and watch that portion of the video again and see if that axis makes sense to you. If it's still not making sense to you, what I want you to do is now visualize it as planes of glass. So picture two planes of glass. They're basically two sheets of glass that are going to sandwich whatever is moving, but the movement will not be breaking the glass. Let me explain it in a visualization way. So here's our flexion and extension again. So if you are flexing and extending your shoulder and you're operating from anatomical position, if you were to put two panes of glass surrounding my arm going up and back down again in flexion and extension, where would these panes of glass need to be in order for me not to break them so that I can actually go up and back down again, and it's just moving in between the panes of glass and not trying to break through the panes of glass? Well, take a guess. And hopefully you're coming up with it's going to be surrounding my arm on either side like this, where then I can have this movement. And this isn't the best video, but bear with me, where I could be moving my arm back and forth and it wouldn't be breaking the glass when I did that because it's moving in between those two panes of glass that we have there. Well, these panes of glass are separating my body from the right to the left, which means the plane is in that same, the movement is in that same plane that those planes of glass are in, those sheets of glass are in. So this would be the sagittal plane. This video, I think, will show it a little bit better when we get to abduction and adduction of our hip. So here's abduction, adduction, right? So I'm going off into these two different motions, going out and then back in again. If we were to put planes of glass on the different sides of my body, where would these panes of glass need to be in order for me to keep doing this motion without breaking these sheets of glass? So take a guess. And hopefully what you're coming up with is that these sheets of glass would be on either side of my leg in the front and in the back. So this is going to allow for my motion where I'm coming out and back down again. And it's moving in between these two sheets of glass and it won't break those planes of glass or those sheets of glass. So these panes or these sheets of glass are running along the front and back of my body. So it's essentially the same plane that's separating our front from our back of our body, which means this is the frontal plane, or also known as coronal. All right, let's do it with another one. So we've got our rotation. Remember our shoulder rotation for our internal and external shoulder rotation. That one's a little bit trickier. So do your shoulder internal and external rotation, or your medial and lateral rotation. And I want you to visualize, where could you put these panes of glass or these sheets of glass that when you spun, your hand wouldn't end up actually hitting either of those panes of glass? So where would they be? It's a trickier one, but what you'll see is that you would have to put the sheets of glass at the top of the shoulder and at the bottom of the shoulder in order for me to really be clear from that glass. So now if I've got that motion of going around internal and external or medial and lateral, it's operating in between those two sheets of glass and it would not break it, which means that this is what's separating the top of our body from the lower portion of our body. So this is our transverse plane. So hopefully one of the two different styles works for you, either looking at the axis of rotation or looking at the panes of glass, right? So the axis is always perpendicular to the plane of movement. The panes of glass are always in the same plane as the movement. I encourage you to go back, watch again if you are still having questions. So here is a slice of our face. This is actually our eyes right here and our nasal passages. And this is of a lot of the structures of our bones that we have here. This is our ethmoid bone. And then we've got here our nasal concha that are coming through the orbits of our eyes. So which plane of the body is this shown in? Is this picture coming from? That would have been coronal. All right, a few more questions for you just to kind of test your knowledge. And let's do our movements. Flexion and extension occurs in which plane of the body? Transverse, coronal, or sagittal? We are going for flexion and extension is in the sagittal plane of movement. Medial and lateral rotation, also known as internal and external rotation, occurs in which plane of the body? Horizontal, median, or frontal? So this is actually the horizontal. Remember, that's the same name as the transverse or axial. Median is the same as our sagittal, and then frontal and coronal means the same. So this was the A horizontal. Abduction and adduction occurs in which plane of the body? So we are looking at our coronal, also known as our frontal. Supination and pronation of the forearm occurs in which plane of the body? Think of this as very similar to what we had with our shoulder rotation or hip rotation because it is a type of rotation. So we are looking at the transverse plane of movement. And as a cheater, I'm just going to let you know all rotations occur in the transverse plane of movement. So that's another way to be able to remember that. It's not always the case when we get to flexion and extension and abduction and adduction, although for the most part they tend to congregate where flexion and extension are in the sagittal plane and abduction and adduction is in the coronal or frontal plane. But that's not always the case. But with our rotations, it's always in the transverse plane of movement. Inversion and eversion. Which plane does this operate in? And this is a kind of a harder one. We are looking at the frontal plane or coronal plane. In order to make inversion and eversion happen, you would have to have a pane of glass coming up, touching by the top of the front part of the toes, and then another pane of glass right at the heel, going up and down the body, separating from front to back. Or if you want to think of it as far as the axis of rotation, that axis pin would need to be just like right in the back of the heel in order for that fastener to still allow us to invert and evert our foot. Rotation of the shoulder occurs in which plane? Now remember, make sure you are doing rotation and not circumduction. Rotation happens in the transverse plane. So we would have that pin going in right through the top of the shoulder, or if we're doing panes of glass, we would need to have the pane of glass at the top of the shoulder and down by our fingers, cutting across that transverse plane of the body. All right, here's a kind of trickier one for you. Elevation and depression of the scapula occurs most closely to which plane? So remember, this is our shrugging of our shoulders up and shrugging of our shoulders down, or lowering of them down. So you're kind of remember thinking of it as the scapula are moving up and down along the side of the body. So if I were going to put two panes of glass up, they would need to be around my scapula on the front side of them and on the back side of them. So that would be separating the front from the back, which is our coronal or frontal. Or if we had an axis of rotation, it's harder for us to do just because it's elevation and scapula, which is why this is a harder one to answer. So it's better to look at the panes of glass for specifically the scapular movements because they don't operate in the same kind of a joint that the rest of our bodies do. And just so you know, this often is called the scapular plane, which is why I said that it's occurring most closely to which plane, because really it's often called the scapular plane. All right, that's what I have for you. I hope that this makes a little bit of sense for you, but I would encourage you to go back and rewatch until things are making more sense and that you can actually answer the questions without having to second guess yourself because this is a tricky topic and we will be practicing it more. But I just wanted to give you a brief introduction to those planes of movement.